Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I perform a lot of Brazilian butt lifts, and I do that intentionally. It's been an interest of mine aesthetically. I went down to Colombia in 2009, 2010 to learn some specific techniques of body contouring surgery, and at that time I learned how to do Brazilian butt lifts. So I have special training and special interest in this procedure. You know, of course, a very and most important part of this procedure is what I do in terms of surgical plan and how I do it. But there's also a post-operative course in terms of what we want to do to maintain your results. So a common question that I get after surgery is, you know, Dr. Shapiro, what exercises can I do after surgery? What do I need to avoid? And how long before I can resume normal activity? To understand the answer to these questions, you have to understand what a Brazilian butt lift is. And basically, I'm taking fat from one area of your body, I'm purifying it, I'm re-injecting it into certain areas in your buttocks. Now, I'm not injecting that fat as a filler, I'm injecting it as a transplant. So I want that fat to get its own blood supply. It takes a while for that blood supply to happen, and we like to minimize any variables that could decrease that blood supply from entering that new fat that's been transferred. So generally, we'd like to say about 3 weeks or so before you can really resume more normal activities. So what does that mean? Well, if you have a desk job, you should bring a pillow, and when you sit on your rear end, you want to not have direct pressure on your buttocks. So we want to take some pressure off that. When you're lying or sitting, we'd like to have you kind of put your pressure on the sides of your hips or so to make sure that we don't have direct pressure on that fat, which can be deleterious to the fat survival. There are some just basic parameters that we will provide you, but just understand going forward, if you have this done, about 3 weeks is the magic number. So you want to minimize any pressure on that. You want to kind of alter your activities and your routine to emphasize that and to reflect that desire for that fat to last. Now, after that fat lasts, and usually after about 3 weeks or so, really what we see is what we're going to get. And I have been lucky enough to see, you know, a majority of that fat that I transfer live and give you a long-lasting result. So basically, afterwards, people want to know, are there any exercises that I can do to maximize the result? And the answer to your question is yes. You want to decrease any direct pressure on that buttocks, but anything that we can do to stabilize the musculature of the buttocks and the surrounding musculature to accentuate your Brazilian butt lift will help you. And I say squats are a very, very good thing that you can do, because what you're doing is you're increasing the volume of the muscle in the area, you're increasing the definition, and that will only serve as a foundation to make the fat that I've put in look better. So you'll see more projection, you'll see more definition. So basically the number one exercise that we want to do are going to be some squats or any variations of that. That can be either a full squat, standing squats, sitting squats, or some variation of a squat exercise. So the best way to get an idea of what your exercise regimen should be after a Brazilian butt lift, about what to avoid before, during that 3-week period, is come in for a consultation. I'll explain to you, bring in some photographs of buttocks that you think that you would like. I'll tell you whether I think that's achievable. I'll tell you with regards to your body weight what I think and I can provide you with regards to fat transfer. So don't be surprised if I'm going to ask you to put on some more weight so I have more fat to work with. Thank you very much.